Medicare, and the IEP, AEP, OEP, and SEP. I have all the details and the dates, the timelines, the deadlines, and the date ranges you need to know, as this can be massively confusing. I will do anything I possibly can for you here in this video to help you understand all this and navigate this very confusing time. So with that being said, let's get into it and start talking through all the details. All right, first off, if you're watching this video, I anticipate you are in the range of either enrolling for Medicare, looking for a supplement plan, trying to understand and determine, do you want Medicare Advantage, Medicare Part D, what are all the differences, and trying to understand what is going on with Medicare. It can be massively confusing. In fact, not that many months ago, I helped my parents go through the process of applying for Medicare, getting supplement plans, things like that. It was a mess. It was a nightmare. It was so confusing. They had a million questions, as I anticipate most people do. And I thought, you know what, this is a mess. This is an absolute mess. Why is it this confusing? Has anybody else ever asked that? Why is this so confusing? It's not supposed to be this hard, but it is, unfortunately, okay? So anyway, let's talk through these different acronyms that I said at the beginning of the video. Again, IEP, AEP, OEP, SEP. I will give you all the details behind them. But first off, you see that phone number there on your screen? If you are in the process of applying for your initial Medicare or looking for a supplement or Medicare Advantage, changing any of your plans, or getting a Medicare Part D plan, anything like that, that number right there, that phone number, will connect you with my partners over at Chapter Medicare. And again, I've partnered with them because it was such a mess with my parents. I thought, I don't want to ever see anybody like this go through that they struggled with, and the confusion and the frustration, things like that. So again, I partnered with Chapter Medicare about this. But anyway, you'll be connected when you call that phone number with a dedicated Medicare team. They will go to work for you on your behalf, 100% for free, looking through the 24,000+ plans across the country and the ones in your local area to find the best fit for you, so you can see the providers you want to see, get the prescription coverages you need or possibly don't need, any other personal preferences you may have, and they will find you the right plan, not just a plan, and they will help you out through this incredibly confusing process that a lot of people, unfortunately, try to navigate themselves. Bad strategy. I'm just saying that. You want assistance doing this. And again, the guys over at Chapter Medicare, my partners there, they will go to work for you for free, and they will find you the plan, which, by the way, quick side note, on average, the average senior that they work with saves $1,100 by working with them, just because they have the right plan rather than just a plan, okay? Massively important. Having the right plan versus just a plan is so incredibly important right now. You probably know that. Getting the right coverages, saving a boatload of money, sounds perfect to me. Anyway, give that phone number there on your screen a call. Otherwise, down below in the description at the top of the comment section, I also have the phone number there and a link to their website if you want to look at that. Check it out. Again, they'll take care of you there. Okay, so let's talk about Medicare IEP first off. Okay, so I'm going to go through this one at a time here and give you the details you need to know. Okay, so a Medicare IEP stands for Initial Enrollment Period. Basically what this is anybody turning 65, you can do this any time of year that you want. There's no timeline on this. You could do it in January, you could do it in March, you could do it in September, you could do it in April, you could do it in December. It literally does not matter. It's based on your birth date, or your birth month, I should say, okay? So here's what it happens to be. The birth month in which you turn 65, you have a 7-month window, okay? So you have the 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. It's a 7-month window that is allowed for you to enroll in Medicare. If you enroll outside of that 7-month period, as in after the 7 months have expired, you would then be sustaining a penalty when you enroll in Medicare, okay? So you don't want to get a penalty, right? You never want a penalty. But anyway, there are exceptions to the rule, okay? I can talk about that later if you want, or a separate dedicated video. I don't want to add too much confusion here to this. But anyway, that is the initial enrollment period. It's predicated on your 65th birthday and the month in which you turn 65. That's when you can enroll. 7 months there, okay? So I would say this much: do it sooner than later. It's going to take some time, okay? And again, if you call my guys over there at Chapter Medicare, the phone number there on your screen, they will help you take care of your supplement plans, you know, Medicare Advantage, whatever it happens to be. They will help you out with all of that, and you'll be super happy you did. It'll give you a huge sigh of relief by working with them. Okay, so that is the IEP, Initial Enrollment Period. I can certainly elaborate on that further. Let me know down below in the comment section if you'd like me to. I can certainly make dedicated videos on all of these or jump on live streams, whatever you need. Okay, next, let's talk about AEP, Annual Enrollment Period. Now, this happens every year between October 15th and December 7th. So it's honestly not that long. What is that, about what is that, 7 weeks or so? Yeah, it's about a 7-week window, kind of right around the end of the year. This is the annual enrollment period, AEP, October 15th to December 7th every year. And these are for plans that go into effect as of January the following year, okay? Now, here's what it is. Anybody on Medicare can go in and out of plans, change your plan, get a new plan, whatever you want. Basically, it's open enrollment for everybody on Medicare, okay? So they just open up the floodgates, and they say, here, you got about a 7-week window here. You can go in and out of plans, get a new plan, whatever you want. This is the open enrollment. And then you get locked in for the following year. January, the following year, is when that plan goes into effect, and then you're locked in, right? Okay, so that is the annual enrollment period. Again, October 15th to December 7th is when that opens up, okay? Now next, let's quickly talk about the OEP. Now the AEP and the OEP honestly do get confused quite a bit, but let me explain the OEP. This stands for Open Enrollment Period. Huh? Open enrollment and annual enrollment, doesn't that sound like the same thing? It kind of does. Kind of sounds like the same thing. I agree with you, but it's actually not. It's very different. So the open enrollment period runs from January 1st through March 31st every year, and this is for those people on Medicare Advantage. Medicare Advantage, okay? I can explain the differences if you'd like me to between Medicare, traditional Medicare, and Medicare Advantage if you want me to. Again, more confusion. Yeah, which one do you choose? More confusion. Again, there's so many moving parts here. They've got to make this more easy, right? It should not be this confusing. Anyway, the open enrollment period, again, January 1st through March 31st is when that it opens up. Okay, so it's a 3-month time frame there. Medicare Advantage beneficiaries, same thing here. You can go in and out of plans, change your plan, whatever you want. You can transition back to traditional Medicare at that point if you want. Okay, so there's a lot of options there. And this is the open enrollment for you, okay? And then you're kind of locked in again. So kind of have at it, do whatever you got to do during that time frame, change your plan, whatever you want. If you want, you don't have to. You don't have to. It's totally optional. You can keep your current plan if you want to. Totally fine whatsoever. That is the open enrollment period, okay? Now let's quickly talk about the SEP, special enrollment period. Yeah, special enrollment period, okay? Now this is available to those people who have a change in their circumstances. A lot of the times when it comes down to Medicare, the special enrollment period is basically for somebody who's covered with a like an employer insurance plan, and then all of a sudden they stop working or they lose their insurance there from their employer. Then they would go into this special enrollment period. Now again, this could happen anytime throughout the year. It does not need to be within the annual enrollment period. It does not need to be within the open enrollment period. It could be any time of year. But if you lose insurance coverage from an employer or whatever your previous coverage was, if you lose that coverage, then you have now an 8-month window that you can enter into this special enrollment period where you can get insurance during that time, okay? So again, this is only for people who have a change in their circumstances. They lose their insurance. There are some other circumstances in which the special enrollment period does apply as well, but this is by far the most common. Somebody's, working after 65 and they say, hey, I'm kind of done with this thing called work. I just want to retire, enjoy my life, enjoy my family, not be here working, you know what I mean? And then they say, I'm just going to be done with this. So they decide to retire, and maybe they're like 66, 67, whatever it happens to be. I'm just giving some examples here. And then they lose their health coverages from their employer. They would then get into this special enrollment period where then they have this 8-month window where they can just apply for a plan, okay? It could be a supplement, it could be Medicare, Medicare Supplement, Medicare Advantage, whatever you want, Medicare Part D, all of it, it's right there for you in that, okay? So very, very confusing. Now really quickly, let me hit on this because I mentioned this a second ago. Well, okay, a couple minutes ago now. But let me just hit on this a second, and then I can make a dedicated video if you want me to. I can jump on a live stream, whatever you need, let me know. I'm here to serve you. I'm here to help you with this. And again, I saw this. I helped my parents go through this mess. It was an absolute nightmare, like I said. They had a million questions. My dad was going to seminars. He's going to classes. He's meeting with people. He's calling me constantly. Every time I see him, he's got a list of questions about Medicare. Yeah, that's why I'm making these videos, because, again, just huge headache, okay? If I can help you out in any way that I possibly can, I want to do that for you. Okay. Here's the difference between traditional Medicare and Medicare Advantage. Traditional Medicare, basically, you are enrolled in Medicare Part A, Part B, and then you have those, okay? But here's the thing. Medicare Advantage is also called Medicare Part C. Medicare Part C. What this is, it is basically a private held insurance plan with approved providers or improved plans that are basically the equivalent of Medicare, but they encompass all of it. Medicare Part A, Part B, and Part D, all of it included. So these are actually very popular. To be real with you, the majority of people are actually enrolled in Medicare Advantage plans. In fact, according to the most recent numbers that I've looked up, 33 plus million people are enrolled in Medicare Advantage plans. Meanwhile, that encompasses about 54% of all people enrolled in Medicare or eligible for Medicare. So the majority, technically, are actually enrolled in Medicare Advantage plans. Now, is it right for you? I don't know. I don't know what's right for you, okay? We don't know what's right for you. The only person that knows that is you. I mean, here's the thing. You may know that or have an idea of, do you just need the traditional Medicare, Part A, Part B, maybe throw a little supplement on top of that? Or do you need the full, the whole enchilada thing? You know what I mean, right? Do you need the whole basket of services, the A, the B, the C, and the D, and all of it, right? That's the situation here with Medicare Advantage, is they have it basically all wrapped up into one with privately held plans that are available that have all of it, and these are approved by Medicare as well, okay? That's what those are. There's a ton of them out there. In fact, did you know there's over 24,000 plans available across the entire country? That's nuts. Again, do you realize how many plans are available in your local area? If you start looking through those on your own and try to find one for yourself, first off, you're going to be overwhelmed. I guarantee you that. There's so many different plans out there. They all sound so similar. There's a little bit different between all of them. They all have different coverages, different deductibles, different co-pays, different premiums. You'll be overwhelmed in no time. And again, this is exactly why I've got my guys over there at Chapter Medicare. They will go to work for you. They will do it all for free. They will do the work. They'll do the grunt work. You just sit back, relax, and let them do the work. They'll present you your options. They'll save you money, get you the best coverages, and find you the best plan in your local area, again, so you can see the providers you want to see. Whatever your preferences are, they will help you get that. Rather than you sitting there trying to grind this stuff out, calling and sitting on their websites. I've done it. It's not fun. It's a lot of time sitting on insurance websites. I've done it. It's not how I like to spend time. I'm just being real with you. That is not how I want to spend my time doing that stuff. And then you've got a list of plans, and it's like, I don't even know what to choose here. There's 50 options, and I couldn't tell you which one is the best, right? Well, that's, again, why Chapter comes in here. And again, that phone number there on your screen, you call that. You'll be connected with that dedicated team there. They will go to work for you. Nice guys over there. By the way, if you call them, tell them I say hi. They're doing such amazing things for those of you here in this community. I'm so happy about it. Again, I've seen comments from many of you here in the community reaching out down below in the comment section, sharing with me your experiences when you connected with them through that phone number. Really good stuff. A lot of money savings, better coverages overall. Really, really cool stuff. Anyway, I hope this helps you. Again, I can make more dedicated videos on this. I can break all these down one by one and go way more in depth on all of these. I can talk about traditional Medicare, Medicare Advantage. I can talk about all of them, whatever you need. Let me know what I can do to help you through this, okay? I can sit here and make all the videos in the world and guess what people need based on the experience that I had helping my parents go through this. But that's not going to be everybody's experience. I mean, in general, the overwhelm, yes. The confusion, yes. The frustration, yep, check, right? All of these are going to be on the list. But if there is something that is very specific about this, please let me know. I am here for you in any way that I possibly can be. That's my dedication and my promises here on the channel. I've been doing this for years and years and years. Go back and check my track record. I have thousands and thousands of videos every single day talking about this stuff, Social Security and all these fixed income benefits. I truly want to help you navigate this. It is way too confusing than it needs to be. Way, way more confusing. It should not be this hard, right? So anyway, I want to do what I can for you. Again, call my guys over there at Chapter, the phone number there on your screen, the website link down below. You'll be super happy that you did. They'll save you a boatload of money and get you awesome coverages. Otherwise, let me ask a huge, huge favor of you. Number one, who do you know? I know you know a couple people. 1, 2, 3, 5 people. Who do you know that benefit from this information? Neighbors, friends, siblings, right? That's a good one. Acquaintances. People that you meet with every so often, things like this. I know you know some people that are in the same position as you, applying for Medicare, changing your Medicare plans, confused on Medicare, all this stuff, right? If you know those people, think of them. I know you can think of a few. Share this video with them. Please share this video so they can also be aware of what's going on right now. And again, I will continue to do what I can to help all of you and serve you here in this community in any way that I possibly can. Again, there's a share button right down below. share this video with them. Otherwise, take a screenshot. Take a screenshot with your phone right now of this video and text it over to them. They can see the phone number there on the screen. They can see the title of the video. They can see the channel name here as well. They can look all this information up, and they can call my guys over there at Chapter and get them taken care of as well. You'll be a huge hero to anybody you share this video with. They'll be super happy and so grateful for this information. Anyway, please subscribe down below as well. 100% free to do so. Big subscribe button right down below the video. Thank you. Truly appreciate it. Otherwise, check out the other 5,000 plus videos here on the channel. Stay tuned. I'll keep you posted with everything going on right now. Otherwise, thank you so much for your continued support here on the channel. Thank you for allowing me to advocate and represent you. Thank you for your continued support and trust in me and the content and the videos and everything I'm serving to you every single day in these videos. I truly, truly appreciate you. Thank you for being part of this. I just really appreciate all of you here in this community. Otherwise, have a nice day. That's all that matters, and I hope I can see you again soon in the next